Designed in the U.S. by emergency care professionals, the XCollar, the cervical splint, represents an innovative approach to the treatment of cervical spine injuries. The XCollar is the only device that can be custom fitted during application and is able to immobilize any patient in the proper neutral position, regardless of their body type or size. It allows first responders the ability to stabilize a victim's cervical spine in position, or what's commonly referred to as a position of comfort, minimizing the patient's manipulation. Collars that are currently in use by the EMS industry are inadequate by design, forcing large or small patients into a default position and creating unwanted patient manipulation. These collars do not isolate or secure a victim's head to prevent any further spinal trauma from occurring, but rather have become more of a psychological crutch than a tool. The XCollar is the only device in the world that allows rescuers the ability to immobilize a patient, isolating the cervical spine by splinting the patient's head to their torso, and keep them in proper position, dramatically reducing the chances of additional trauma, or in some cases, paralysis. In the case of a multiple casualty incident, or MCI, the XCollar becomes a force multiplier, allowing fewer rescuers to effectively initiate spinal immobilization on multiple patients in a shorter period of time. The XCollar has been designed by U.S. emergency care providers to give EMS and rescuers the best tool and capabilities for immobilizing a patient with a suspected cervical spine injury. One device with a wide range of sizing options, so any victim of any body type can be secured in the proper neutral position or in a position of comfort. The XCollar has been designed with 24 possible vertical positions with custom bilateral adjustability. By eliminating the need for guesswork, in effect, the XCollar will be the most valuable and effective tool in a rescuer's spinal immobilization kit. XCollar, the cervical splint, made by Emagear.